Well, welcome to the Cutting Edge, where we discuss all things health and wellness. I'm Omar Neal. I am one of the hosts of this wonderful new program we have here, the Cutting Edge. And of course, this program is being brought to you in part by the White House, as well as the University of Maryland School of Public Health. And of course, I host the syndicated radio show, You Got the Power. And we've been doing this thing for many, many months, maybe a couple of years now. And we invite you to join us all on Facebook, on YouTube, on Instagram and Twitter and Facebook and all of that. We want you to join us because every Thursday evening, the family joins in talking about issues that impact you, all things health and wellness. And so we're excited to have a great program today. We're going to be talking with some people who are part of an organization that I truly admire. They call themselves ABPSI, that's the Association of Black Psychologists. And of course, Dr. Donnell Barnett will be joining with us. He's the current president of this organization. We have Dr. Sharon L. Bethea. She is the president-elect of this illustrious organization, and Dr. Marva Robinson, who is the chapter president, former chapter president of St. Louis. And of course, we are so appreciative for them being here and sharing with us today. But I can't go any further before I introduce my sidekick. We call him Dr. T, but he is Dr. Stephen B. Thomas. Hey, man, how you doing?
Hey, Omar, it's always good to be here with you every Thursday night. Do you know we're probably coming up on about 2 years of doing these shows?
Yeah, I was thinking, when you do something so long, you wonder how long have you been doing it? But we've been doing it for 2 years. And I'm so excited about the topic, man. Thinking about this compounded trauma, the intersection between racism and COVID-19 pandemic. This is something that I don't think a lot of people really discuss, Dr. T, is when you're already in an oppressed situation, then it's compounded when you have something like a pandemic. And we are seeing the disparate impact that the marginalized communities have with this pandemic. And we know that it's due to the fact that there were infrastructure issues in as it relates to health that made these populations more vulnerable. And that's why it's important that we talk about it and see how we are faring both emotionally and psychologically through this pandemic. And that's why we have the members of ABPSI here to help us kind of process this. And so I'm excited to do that.
I'm excited to bring them up and to welcome them from the School of Public Health and to share our commitment to stay engaged with these communities, to build a bridge of trust, and to recognize that the 800,000+ souls we've lost have left children behind who have also been traumatized. And maybe we'll learn tonight about generational trauma and what we can do to help people seek help without feeling stigmatized, what terms we use, like emotional wellness instead of mental health, issues of managing stress so that it's not so deficit focused. And you know what, Omar?
Mm-hmm.
Just watching the barbers and stylists in action, there's something therapeutic occurring right there in the chair. And here we are bringing them together with the barbers and stylists and the experts in psychology. What a show we have tonight.
Absolutely. Well, you have to realize barbers and stylists also do psychologists' hair as well. So I mean, so hold up. There's no separation. We bringing them here, but they already together.
There you go.
So, but anyway, we're gonna have a great time. Let's bring up the current president of this illustrious organization, Dr. Donnell Barnett. We're going to bring him up and kind of chat with him. Dr. Barnett, how are you doing today, sir?
I am wonderful. Thank you. Thank you so much for having me. We really appreciate the invitation and to share and be a blessing and a benefit wherever we can. Thank you so much.
Tell me a little bit about yourself, because I want to make sure. Oh, Doc, you want to say something?
Yeah, I just want to say, welcome on behalf of the School of Public Health. These barber poles are our metaphor for the kind of space that we want to have here, where we have conversations where we can agree and even disagree, but not be disagreeable with one another.
Yeah. Oftentimes people can read your bio, but I want you to just tell us who you are from your perspective and introduce yourself to our audience.
Well, sure. I am Donnell Barnett. I'm the son of Roy, the grandson of Marvin, the great-grandson of E.W. We are in Chicago. My family's from Chicago, and I do a number of things. I mostly work as an administrator over mental health programs in the state. And obviously, I have the pleasure and the honor to serve as the 47th president of the Association of Black Psychologists. I'm really concerned about communities. I'm concerned about some of the social and economic pressures that our people in particular face. And so I try to point my efforts and my professional efforts, my personal efforts, just try to point them that way. And certainly, and from a spiritual perspective, very much concerned about how we integrate faith in our wellness as well. So those are some of the things that, kind of stand out to me personally. Of course, my lovely wife and son, we are in Chicago as well.
Wonderful, man. Well, again, welcome to the Cutting Edge. It's so good to have you with us. Dr. T, Dr. Barnett was on the You Got the Power show before, so he's not new to this kind of exchange. So we welcome him into this space. Let's bring up our president-elect, Dr. Sharon L. Bethea. Let me talk to her a little bit and tell you how appreciative we are, Dr. Bethea, for your being here, and congratulations on being the president-elect of this illustrious organization. So tell us a little bit about yourself.
Yes, hi everybody. I'm Sharon Bethea, and I'd first like to honor Set and our African ancestors and my family and community in which shoulders I stand. I am the mother of John Sharper, the daughter of Goldie and Lewis, the granddaughter of Golden and Nana Lou and Marie and Robert. And so I always want to give honor to those who came before me. I currently serve as professor in counselor education at Northeastern Illinois University, also professor in inner city studies, and I run the African-American Studies program. I'm also a co-founding member of a project we just started, we lovingly call GRAD, but it looks at genocide and human rights violations in Africa and the African diaspora. When I think about my scholarship, I like to look at African-centered pedagogy, African traditional healing systems, civic engagement amongst African and African-American youth. And I've been doing the business of serving the African community for 3 decades now, almost 3 decades, my age. And how do we bring these culturally consistent, culturally congruent ways of being led by communities? And we'll talk more about that as we begin to tackle this project. But I am honored to be here. So thank you for inviting me.
Omar, I'm realizing that as we stream live literally to the world, there are people who are meeting Black psychologists for the first time. And some of them are Black people. I say that because we've had moms and dads say, I need help. Do you have a Black therapist I can go to? And it's not easy to find. And hopefully we'll come out of this with a way that in your barbershop or salon that's part of this network, you have a connection to an array of therapists that look like you. So thank you so much for being here this evening.
Yeah, and thank you for joining with us. And of course, last but certainly not least, want to bring on Dr. Marva Robinson. Hey, Dr. Robinson, how are you doing?
I am doing wonderful. Thank you for this wonderful invitation.
Absolutely. Well, tell us a little bit about yourself.
I also just want to acknowledge the fact that the work of our ancestors have made it so that we can have such an important space like this, and to be able to have such a critical dialogue as the one I know we're about to have today. I am the granddaughter of Jessie Mae Robinson, the proud daughter of Marva Robinson Sr. and Gil Gridiron, and the proud mom of newly 11-year-old Preston. I am born and raised St. Louis, Missouri. I did leave for undergraduate and graduate school, but always knew that I would come back to St. Louis. If you've never been here, or if you've probably heard about it, it is a very unique space. Segregation still very much alive and well. And so what you just spoke about, people not even knowing that there are clinical psychologists that look like them that exist, was one of the reasons why I knew I would always return back home with my skill set. I currently work in primary care as a primary care psychologist. And so I still to this day meet adults that don't even know that they have the right to ask for a psychologist of color, let alone ask for a physician of color. So a lot of my work is on educating patients on the healthcare system, what rights they have, how they can come with questions, how it is okay to challenge certain things. I think the more we become educated patients, the better we're able to navigate our own healthcare. And I also have a really big focus in community trauma and violence. So a lot of our work from the St. Louis chapter of ABPSI was alive and well in 2014 with the murder of Michael Brown. And so we still continue pushing forward a lot of that work and a lot of that healing. And so I'm very appreciative to be here today.
Good. Well, we are so happy to have you with us. Well, let's go to the Hollywood Squares and let's have this conversation. Let me say this. If you notice, Dr. T, that everybody acknowledged their ancestors. They acknowledged where they came from.
Yeah.
That's so important. So I want to ask, I want you all to all unmute because I want this to be conversational.
And Omar, just let me say this as you set this up. As they were doing that, and I was trying to do it in my own head, I ran into some gaps real early.
Right. Well, most people
I did not
can't
know.
go further than some people can't go any further than their parents. And some people don't even know their parents, right? Some fathers don't know some fathers. Some children have never met their father, don't even know their father's name, don't know that side of the family. So I want to ask this question. It's a rhetorical question, but why was that important when I asked you to tell us about yourself?
Well, as a part of one of the tenets of our organization is really connecting our present reality with our cultural historical roots and understanding that we are a part of a lineage. And by knowing that lineage, by being connected with our heritage, with our lineage, with our culture, not just immediate culture, but ancient culture, that it has a way of empowering us, of enlivening us, which is critically important from a mental health and wellness standpoint. So that's sort of a broader answer, but I'll say for me personally, it's very important as I move about this space and move about this world now to know that Marvin Barnett and E.W. Simpson were proud Black men who came up from Mississippi and Alabama to Chicago to negotiate a world on their terms. And what that means for me today means that whatever it is that they had to face and struggle and encounter, they overcame that. And it gives me courage. It gives me power to know that I can do the same today. So, you know, that's one, that's part of why history is so important.
Sure.
And to add to that, you're right. You know, there are sometimes gaps, and in full transparency, I mentioned who I'm the granddaughter of, but I did not list a grandfather. And so sometimes those gaps are there. But for me, being able to acknowledge the grandparent that I was familiar with and that was a part of my life is just as important to acknowledge those who were there as much as those who were not. And then when I get to my mom, I say the proud daughter of, because it's a reminder for me that every day I remember the sacrifices that she made for me. I am some of the dreams that she had that were not lived for her. And so being able to pay honor back to her in that way is kind of like saying those I love yous that you wish you could say all the time, but sometimes you forget because you're busy. So when you have spaces like that, being able to give that acknowledgement is kind of like giving those roses.
I like that.
Yeah.
And I'll add to that. I always have to acknowledge my amazing son. So many people sacrificed for me to be here. My mother constantly talks about my PhD, but she has a huger PhD than me and just a warrior. My family, when I was having issues in school or having issues in the world, that was always a safe space. So I have to acknowledge that where I came from is important. Whom I belong to is important. Why I belong to them is important. And I also think it becomes great as we begin to tell our stories. We have to tell our stories and our narratives and who our family, where they came from. Many of us from the South. My family's from North Carolina. And so, in hearing the stories of what happened during those years, I honor that and like to honor that everywhere I go, because I am them, I am their dreams and they're mine.
Right. Hey, you know, Omar, as I'm listening and realizing that it, for me, was Isabel Wilkerson's book, The Warmth of Other Suns, that let me know, oh, I'm part of that great migration.
That's right.
I'm part of that great migration. And in our communities, we have this thing called the fictive kin. And some of my colleagues don't get that you can have a person who's not a blood relative, but just maybe even closer than one. Fictive kin, real, important, particularly for those who have gaps in that history.
Oh, absolutely. I know in my travels on the continent, I would meet people and they would be with their friends, especially little kids. And they're like, this is my brother from another mother. That's how they always said it. This is my brother. And that's who they hung with.
Or play sister.
Play sister, right?
No, it's sister
play
from another,
brother.
it's sister from another mister. It's
Yes,
sister from another
another
mister.
mister. So all these things have always been in our neighborhoods. My sister has a different mother and father, but she's absolutely my sister. So we've always made a way. And I think that's always been in our communities, how we have family that extends.
Yeah.
The village.
I gotta believe that it's that detachment that calls for many people to feel alone, to feel a sense of hopelessness, right? And if we can reattach ourselves not only to our immediate ancestry or our immediate parents and grandparents, but even to go back to the continent, that's where our strength, as Dr. Barnett said, that's where our strength lies, in our connectivity to who we are. And that's so critically important. Let me bring up Dr. Tuesday Cook. She is part of our team. Dr. Cook, tell us a little bit about yourself. I know who you are, but tell everybody else who you are.
Good evening, everyone. I feel like I should give my lineage too, but I won't. In the interest of time, I honor them every day.
No, you if you want to do that, Dr. Cook, you can do that.
They know. They know.
Okay.
The ones up there and the ones down there, they know. So I am Dr. Tuesday Cook. I'm a fellowship trained minimally invasive foregut and bariatric surgeon. I trained at Howard for medical school and residency, and I am the director of an MIS foregut and bariatric program in Fort Washington, Maryland, which is part of Prince George's County. And I really enjoy and love being here and being a part of this discussion and being able to contribute from my aspect which really comes from a wanting to ensure that not only are health disparities decreased, but patients who suffer from obesity get the same care that everyone else gets, and that the people who suffer from obesity and the comorbid illnesses that are associated with it get the care as well. And, we already know that the data shows that 1/3 of the patients in the ICUs are patients who suffer from obesity. And many people are not vaccinated. I have patients who ask me even today if I could sign off on them not having to be vaccinated. And so it's very important to me that we dispel notions that are untrue, and we get our people vaccinated so that we can avoid illness, just like other people are.
Wow, you're absolutely correct. Let's bring up Dr. Tuesday Cook and bring her into the house as well.
So Tuesday,
excuse me, Dr. Ritter, Dr. Carol Ritter. You got to say Dr. Tuesday Cook repeatedly. I mean, it's she summons me.
I guess she's my co-sister.
It's pretty much my sister, right? My sister from another mister. I was just about to say the same thing.
We look alike, don't we?
You're your sister from another mister, right?
But just for a second here, I want our psychologists to know that these two physicians have been with us over these 2 years. They've been our resident experts when it comes to these medical questions, dedicated to this show.
Yeah.
Dr. Ritter?
They're family. Yeah. So Dr. Ritter?
Right. And I just want to say that I was touched so much by your introductions of yourselves from your family and ancestors, because I struggle introducing myself, but it almost brought me to tears because my family is so critical to me, and I never introduced myself that way. I'm a girl from Wisconsin. Somebody asked me about my lineage once. I say I'm from Wisconsin and from the farmland, but I'm an OBGYN who has been working in women's health for over 3 decades. And the struggles of women are the voiceless. And I really love what I do. And it's really a passion. So being in this space has opened my eyes in so many ways that has helped me help the women in my practice. And the pandemic has brought me in this space. It's like the silver lining of this space that shows me our infrastructure is really hurting in healthcare, and the community is going to be our way out to talk to the community and get community involved. The barbers and the stylists are beautiful in that way. So I thank you for letting me be here.
Thanks,
Omar,
Dr. Ritter. Yeah.
Just 2 things. And that was number one, when Dr. Ritter described how coming into this space has helped her change the way she interacts with her patients. That was important. And I'll never forget, Dr. Tuesday Cook, when you described how the pandemic has kept the family out of the hospital, and that you said that having that family in the hospital at the bedside was actually therapeutic, was actually healing.
Mm-hmm.
It absolutely is. There's something to be said with the power of touch, power of smell. We only, talk about pheromones a lot. We don't talk about scents, but even if you go into, your husband's closet or your kid's bed, you lie down, you smell them, and it's not a perfume, and it's just their essence that you're used to being around. And there's something healing in that. There's something healing in, somebody just coming by in ICU and sitting down and holding their hand, and they just know that you're there. It's different when people were dying in the hospital with no one there.
Right.
And it's hard for the people who are outside as well, but it definitely has healing powers, just like laughter.
Yeah, I agree.
We laugh here too.
Absolutely. Bring up Aaron Perry. I want to bring that brother up and have him share with us. Hey man, how you doing?
I am doing well, thank you. How are you guys doing?
Good. Tell everybody who you are and what you're doing out
Yeah,
there in the universe.
Well, for one, I didn't know Dr. Ritter was from Wisconsin. Yeah, which is cool. Yeah, my name is Aaron Perry. I'm from Madison, Wisconsin. My past life, I was a sheriff deputy, police officer. I hated those jobs, but I'm doing what I'm meant to do now, and that is, work to improve the health of Black men in the state of Wisconsin. And we've been really fortunate to have some national presence. So it's interesting to hear Dr. Robinson, Bethea, and Dr. Barnett introduce themselves this way, because today I did a little surprise interview. The news people showed up at my place. We're about 4 weeks out from opening a free clinic for uninsured and underinsured Black men. And, we needed to do that. We've identified over 700 uninsured and underinsured men in our community. Well, we know there's more. These are the gentlemen that are using the ER consistently for their health care. And so we said we can no longer ignore them. But someone asked the question, why are you doing this clinic? And the first thing that I said was, this is my parents' legacy. They had nothing, yet I grew up feeling like I had everything. I didn't know they didn't have nothing until I got to college. And so this clinic is going to be their legacy, the work that they put in. And so hearing you guys, ladies and gentlemen, introduce yourself, that way I'm smiling because it's just timely, This is how I will roll from now on.
Right. Wonderful.
Awesome.
Thank you so very much.
Let me just say, Aaron wasn't just any police officer. He used the back seat when he had to put somebody in that back seat, even if they were handcuffed, to talk to them like a human and to try to get them care. That is the kind of protection, serve and protect that we need. Thank you, Aaron.
Yeah, if I can share real quick, one of the things is, and I thank you for mentioning that, Dr. Thomas, what started this work is whenever I took someone in custody, I always had that belief that if I take your freedom away, I want to be a part of helping you get your freedom back. And when we get your freedom back, we want you to be better than that person that I took in custody. So anytime I book someone in the jail, I would always show up the next day with a job application. I would show up with housing. I would show up with whatever the struggles that they had. If I can share real quick, there was a gentleman that I asked him, I said, what could have changed? What could have been different to keep you from being in the backseat of this vehicle in the future? And this brother said, I'm $100,000 in debt with child support. I don't care anymore. And right away, I had just attended a program at the Urban League where they help reduce these child support, this number that these men will never get from under. And so I showed up to the jail the next day with an appointment for him. And I said, you're going to get Huber. Huber is when they release you from jail and they keep you in a little halfway house. But I set that up for him. He ended up going over to the Urban League, and within 24 hours, this brother had $1,000 child support bill. It just effort. That's all it took.
Right.
Effort, and you extending a hand to lift this brother up. He calls me his warrior now. I said, no, I'm just a brother in the community.
Now you're a brother from another mother. That's what it is.
Call on me, brother.
Absolutely. Let's bring up Dr. Sharon Cooper. She's part of our team as well. I want you all to know, although I say part of the team, this is family. I want you all to know this is our family. Dr. Cooper, tell everybody who you are.
Good evening, everyone. I am Sharon Gibbs Cooper. I work at the University of Maryland. I have extensive experience in women's health and addressing disparities in quality and access. I currently work for the Institute for Governmental Service and Research at the university and collecting data and working closely with our problem-solving courts, which are diversion programs, to help to address similar to what Mr. Perry had said regarding alternative ways, rather incarceration, in improving social functioning in the community and addressing any sort of gaps and ensuring the fairness to all that need services. So like this, we see the collaborative approach, which transcends into other enterprises in looking at the whole person and not just treating maybe individual for behavioral health or substance use, or looking at those underlying issues and being able to basically connect them to those resources within the community and using that data to help shape and inform decisions and helping legislators to understand the value of such programs. And I'm going to make it short, I've had the privilege to work with Dr. Thomas and Katrina, Mike, and Fred in doing my work for my doctoral degree. And through this particular effort, it just inspired me. And in conclusion, I would just like to say to everyone, your ancestors, all your ancestors are proud of you. The work that you do and the legacy that you're leaving, it's incredible.
Right. Thanks so very much.
You know, Omar, Dr. Cooper was instrumental in helping Mike, Fred, and Katrina, our lead barbers and stylists, become certified community health workers by the state of Maryland. That was not easy. We'll maybe talk about that a little later, really building a whole new workforce infrastructure. Thank you, Dr. Cooper.
You know, one of the things that I want, and we're going to bring up probably another 40 people before this is all over. But let me say this, you know, this whole notion of racism and marginalization and subjugation, I've often wondered, why does it persist? You know, you would think that over the struggle of the civil rights movement, that at least we would be further along than we are today. A person by the name of Enola Aird, you all know her from ABC, certainly, told me this, and she said that the focus is off. We have to understand that the reason why certain people are treated in a certain way has to do with this kind of hierarchy of humanity, by which white people are at the top and Black people are at the bottom, and sometimes less than human. And until we address the issue of what she called the evil twins, that's white supremacy and Black inferiority, right? Until we address those issues, then we can never truly address the issue of racism and all of the residual adverse effects of racism on the African-American community. I want you all, from a psychological perspective, to help me unpack that perspective.
Your mics are open. It's conversation.
This from psychological. I'm talking to my psychologist now.
Well, we need more than an hour and a half to do that, but I'll say it briefly. You know, one thing that I think about in this conversation, for the average person who encounters the education system, the healthcare system, the criminal and justice system, the average person who encounters all of these systems in their life, all these systems to a lesser or greater degree has racism baked into it. And so if I'm trying to make sure that my kids are well, if I'm trying to get healthcare, if I'm trying to use the legal system to advance something that's going on in my life, and at every turn I feel this resistance against me, then that hand of racism, that hand of pressure, you have no choice but to feel the weight, the stress, the pressure of operating in that system. And so I offer that comment just in sort of everyday kind of terms of where these things kind of show up for a lot of folks. And it's hard sometimes to point your finger at a specific thing. It's because there's a system that is driving it, a well-designed, well-crafted, intentional system that creates the kind of environment and has produced the effects that were intended. So that's, you know, just sort of an everyday understanding of that issue.
So you're saying racism is systemic?
Oh, absolutely. Yes.
Absolutely.
Absolutely.
Help us out. Help us to understand that. There was a person by the name of Neely Fuller, said, if you don't understand racism, then anything else you think you understand will only serve to confuse you, right? And so I want to make sure that we unpack this, because we got to understand this part, And then we can begin to really begin to process what's happening to us and with us as it relates to COVID-19. So help me out from that perspective.
So just kind of to add what President Barnett was talking about, if we think about being in America, in a country that's its very root, it's steeped in this notion of racism and white supremacy, that its very constitution was written and ingrained in and embedded in the most vile racism of all time, as people wrote that constitution and went home and raped African women and enslaved African men, that this question of why it's still here, for me, is not such a puzzle. This is what our foundation is built on. This is what, at that time, whoever Columbus was, built everything about America on. What they did to Native Americans, what they did to Aztecs, Native Americans in Mexico, stealing bodies. This is who we are and what we be. And I won't say we, but what America be. So now becomes the question of how do we have this conversation in our families? Understand, I was born in Durham, North Carolina. Even though segregation ended in 1954, I went to a segregated school. We still weren't allowed to go to school with white folks. They were like, build your new schools, just stay away from us. And so I was in this close-knit community that was kind of insulated. Like I tell people, I thought all doctors were Black because I couldn't go to white doctors. I thought all teachers were Black. I thought all surgeons were Black. Not until I moved to the North, I'm like, well, dang, white people do this too. Because in my little bubble, what I saw on TV was the injustices. So when you kind of grow up in that kind of mindset, for me, and I think it's and, it's never either or, it's and, it becomes this thing about what do we do in the community to make sure. I grew up knowing this, putting an army around me, knowing who to be connected to, why to be connected to. So that wasn't my focus. Like, just for me, we can't keep thinking about what white folks are doing to us because they have always done this to us. And that was their invitation to their world. So in the community, how do we go back to traditional stuff? What grandmama said, what mama said that we know worked, right? How we were taught to protect ourselves. And I'm saying that we don't engage because we have to engage, but we have to stop engaging in a way that's saying that our ways of being, our traditional ways of being African, being Black, is inferior. So for me to be okay, I must be like them. Because what we know, that does not work.
Right.
That adds to the mental illness. That adds to the isolation. Because when we walk in the door, we always know they see my face first, right? And everything that's attached to that. So this two-pronged kind of way of doing things. It's like, okay, with the racism thing, I guess some people got to do that, but we are each other's medicine, right? Yeah. We are each other's medicine. We are our ancestors' biggest dream. We are all of that. So how do we stay in that lane and begin to build from there?
Dr. Robinson, go ahead.
And it's so easy for anyone to get caught up. And that's a part of the psychological game of racism, right? We will make this the standard of beauty. We will make this the model of achieving the dream, so that you want that so bad, you go beyond what you know is good and right about you and your community to try to achieve something that was never meant to be about you. But it's like Dr. Barnett said, it's baked into everything, right? Legislation, right? So we have laws and codes on the book that support racism. And then we have the educational institution that is built to support a one-sided view of history, a one-sided way of doing things. And then we have medicine, right? One of the most ones that perpetuate racism, just looking at healthcare disparities. And so even if you don't know the exact history or the year or who did what, you can just look at today's media as to what's causing the biggest backlash. Fights against voter rights, fights against talking about critical race theory, fights about the disproportionate number of Blacks dying from COVID as compared to whites, right? So if you just look at what the stronghold is about, we don't want this taught in our schools, and we need to change these voting laws. There's a reason behind all of that fight and that push, because the truth is racism is baked deep well into it. And so this fight to preserve things, to continue on with this good old boy system is the reason why you see that pushback. It's definitely baked into all institutions.
Go ahead, Dr. Cook.
Dr. Cook.
Yeah, I love that she said that, and I want to take it just one step further. We think about healthcare disparities just kind of starting now with healthcare and the social determinants of health, but if you really think about it, it really is the political determinants of health that are the basis for these social determinants. Back in the 1600s, there were actual, true, and lawful policies that said that Black and Indigenous people could not grow their own food. They could not own their own land. They could not go outside of a 1 mile radius without getting a permission slip, and so kept them in a certain area.
Black codes.
They could not learn a trade, and they could not read and write. And so all the things that would advance them, healthcare, food. I mean, it's simple. You think about food deserts now. Well, think about then when you can't buy, and then you have to buy from somebody else, right? And so those policies were real policies, and it was lawful. And there are still lawful things that it was okay then, and the things that exist now are okay now. And these are the things that we have to fight about. But they really do have their roots in managing policy. That is what really determines what the social determinants then end up being. And it affects healthcare, but it really affects everything. It does affect access. It affects, I mean, anyway, I could go on, and so I'm going to cut myself off now. But I think
you don't have to cut yourself off. But I want to add.
I didn't want you to mute me. I didn't want you to take me out the square.
No, I'm not going to.
No surprise. There's really no surprise.
You're in the house. But let me say this. When you think about it, incarceration does not mean just a jail. It means to limit mobility.
Absolutely.
Right. And so when we began to understand that if I can keep you in this little hood, right, then your jail cell just a little larger, but you still incarcerated.
Mental incarceration.
Go ahead.
Yeah, the other thing that I was thinking about is that after, so we sort of talked about the history and some of the historical things that lead to this point, but then you turn right around and say, Black people don't go to therapy. You turn around and say, Black people don't take care of their health. You turn around and say, Black people don't care about, right? I mean, you start, these messages that blame Black people for conditions that created this situation. Now, if you just think about that, for any rational person, Black, white, or otherwise, you create a situation that is disempowering, and then turn around and gaslight them on the same token, right? That would drive anyone to a great deal of stress. And so, it's just important to understand that environmental piece. And getting back to what Dr. Bethea said, is that it's realizing that we have to step out of the rat race. We have to step out of that wheel and step into our own sense of healing, the ways that our ancestors healed and loved and cared and lived and bead before all of this came about. There's something very curiative and healing there.
Dr. Barnett, just our last session, we had legislators here, and one of them was Jocelyn Pena-Melnick, and she described some of these issues around racism. And in fact, she passed legislation in the state of Maryland to declare racism a public health emergency. And she's very proud of that legislation. So now I'm curious, particularly with our medical professionals here, of how they see that racism getting under your skin, racism showing up in the obesity, racism showing up in late OBGYN care. But you were trained in a way And I don't know if that was part of your training to understand these underlying root causes versus what Dr. Barnett just described, the tropes, the stereotypes. They don't care about themselves.
Dr. Cook, you're
Cook,
biting at
Dr.
the
Ritter?
bit. I mean, you think
You
I'm,
know I
you,
am.
you think
You know
I'm
I
gonna
am.
not, you think
I
I'm not, and
absolutely
then
am
Dr.
chomping at
Ritter,
the
you think
bit.
I'm, go ahead.
So, to address a couple of your questions, I actually was trained in how racism affects obesity. Because again, I trained at Howard. I chose Howard for a reason, for med school and residency. I chose it for a reason. And my first bariatric attendings were Black surgeons. All of my patients were Black patients in DC and in Maryland and in Virginia. And so I saw the effects of how they lived, where they lived, the effects of built environment, socioeconomic status, access to food. I saw it firsthand. And then, I just gave a presentation this past weekend about the social determinants of health and how, we have inadequate access to healthcare, which helps lead to obesity and our medical problems. And then the treatment for obesity, how many people do not get access to that treatment, which is why I started this program in Fort Washington. But there's so many people that don't even know that they could have weight loss surgery and that could help, resolve their type 2 diabetes or their osteoarthritis or their sleep apnea or high cholesterol. But they know, well, my mama had it, my grandmother had it, my auntie has it. I saw patients today. Oh yeah, I have type 2 diabetes and they're 25, and they don't know until somebody offers it to them, until somebody tells them. But I absolutely got introduced to that from then. And then, then there are other facts that you don't know until you start to give presentations and talk to people about how, our children before the age of 2, both Latinx, Black, and Indigenous children, we consume higher caloric intake, higher sugary drinks and foods before Caucasian children. Before the age of 2,
they
with
got
those
corner
epigenetic
stores. They
factors,
eating out of corner stores.
Yeah, that's
they eat
what I was.
food
They
deserts are
don't
are
have
there.
access
They don't
to
have
food, so
access, and it's not just.
that's a
Right.
And
reason why.
let me tell you this last
Absolutely.
piece.
Absolutely.
It's not just about socioeconomic status either, because if you compare across the U.S., you compare neighborhoods of the same socioeconomic status, but that have people of color and that have people that don't have color, then you'll see that there's still more food deserts and higher fast food areas in the places with the people of color. So it's not just socioeconomic status. There's something more at play.
Yeah.
Okay.
Dr.
Ritter?
Ritter,
I
want to
that.
bring go ahead, Dr. Bethea, and then we'll bring go Dr. Ritter, and then Dr. Bethea, I want you to come in. Okay, go ahead.
Well, from a women's standpoint, I want to quote Malcolm X, if I can. Black women are the most disrespected, unprotected, and neglected people in America. And I wasn't taught that in medical school, but I was taught that, Black women have more fibroids, and they have their periods earlier, and they have more cervical cancer, and they have all these things that white women don't get as soon or as often. And then as I practiced over 30 years, I see, that, whoa, white women get fibroids and white women get cervical cancer, and, white women have early menses. So it was like, I recognized I was being taught incorrectly by just the experience. And then I saw how our structural system created where a healthcare system where Black women were on Medicaid, which is an inferior health service, and the access to them was appalling. And they don't even record maternal mortality on death certificates. And they haven't recorded it since 2018, when all states now do record on death certificates if there's a box to see if they're pregnant. So we couldn't even recognize that we have this appalling maternal mortality in the United States, because we have not even been collecting the data on women, because it was Black women. And it's just, embarrassing. It's not the right word, but we have to change the structure, and that's opening our eyes with data. In the pandemic has shown that. I mean, just one more thing, because I don't really want to take up this space. But I do see that the community of Black people are protective of each other. And the JAMA article just came out that basically it's not the mistrust of hesitancy of a vaccine for themselves, but the distrust of the system is really protecting the community, because the community had we don't want to do anything for the community, but now once we say that the vaccine is helpful, we're seeing more communities of color getting vaccinated because they recognize it is protective. So it really is the community that brings the health back together, and our healthcare system has divided it.
Yeah, one thing that we want to do, one of the things we want to do is, and this is something that we do every show, is we try to get a collective assessment of our collective feelings. And so what we want you to do, Dr. T, tell them how to do it, and then we'll then I'm gonna go to you, Dr. Bethea, because I hope you can remember that profound. I saw the profundity in your eyes, and I hope you don't lose it. Please don't
She won't lose it.
Go ahead, Dr. T. Tell them how to do this, and then we're gonna go back to that, because I want to talk about and bring in, can trauma be transferred from generation to generation,
even in the womb,
right? And I want to talk about
Absolutely.
that, right?
Absolutely.
All right. So we're gonna go to this. Okay, go and do that, and then we'll come back.
Think right now how you're feeling at this moment in the pandemic. What word best describes it? Write that word in the chat, and then write the next word and the next word for the next 60 seconds, as many words as possible. And our team will build the cloud, not a sentence, not a paragraph. Don't worry about spelling, just add those words. Right. And as they're doing that, Omar, I just want to say this about the kind of conversation that we're having. I am on a whole lot of different Zooms, and I am telling you, the content coming out of here, the relationships that are being built, people talking with each other, turning to each other, not on each other. That's rare. We should not take it for granted. These school board people fighting over masks, right? 16 miles from my house, downtown Washington, D.C., was a march on Washington against vaccines. So we're in a very interesting moment in the history of our country. So this space is very important for us to come back together and to get that sense of the common good. So I like it, Omar, when you said, this is really family. Right. And even I don't know if it was a Freudian slip or not, when Dr. Barnett said the criminal injustice system, the injustice, was that a slip?
No, that's not a slip.
Right. But that was the first time I've heard it that way.
It's the truth.
It is
right?
The truth.
Right. It's justice, right? Just us. That's what it is. Thank you, Dr. T. Let's as they build the cloud, let's go to Dr. Bethea, and let's find out, because I want you to incorporate whatever your thoughts were in terms of how trauma can be transferred from generation to generation, and what we may be experiencing is not just what we're experiencing now, here and now, but it's also what was heaped upon us through our ancestry. Talk a little bit about that.
Absolutely. And I'm trying to put it all together. But when you were speaking about even the nutrition part, so like you said, liquor store on every corner, fast food restaurants. And I would say that I probably live it's an all Black community, but I'm a professor, so whatever middle class is. But even around me, liquor stores, fast food restaurants, I have to drive a good ways to get some away from a food desert, and I own my own house, but in a Black community, right? Or my own kind in a Black community. So when we look at that kind of intergenerational stuff, bringing it together, that if we even go back to when we were terrorized and brought here, that notion of how we actually consumed food, what was given, what was controlled. Yes, we made lemonade out of lemons, but some of them lemons shouldn't have been guts, but that's all we had to eat, right? And so when we talk about this intergenerational inheritance of the system of racism, that yes, it still makes sense that even if you're in an affluent area as an affluent Black person, that there's been some intergenerational stuff passed down. Not only around trauma, because our very existence in America for most of us has been about trauma. And so you pass that down. The way you eat, the way you live, it's passed down, right? And we tend to become disconnected from the very essence of the things that really worked for us. So, i.e., how much time, for whatever reasons were, that we had to spend outside as children. I mean, it was like, do your chores and get outside. Because that's the only time mama got a break.
Right.
It's like, be honest, outside, and how much time we spent outside. How much stuff, because my mom couldn't afford it, that we actually grew. I mean, I remember being driven crazy by her garden, but we couldn't afford it otherwise. So why do we keep that? That couldn't afford the medicine. And now we're understanding how actually amazing cod liver oil. Do you remember your grandma's like, 1 if you're kind of sick, 2 or 3, and you hated it. But now we know what that was building.
Castor oil. Do you remember castor oil?
Castor oil, cod liver oil, stuff, whatever that she rubbed all over.
Yeah, black something. What they call it? Black something. It was something. So, I remember it. You bringing back memories, doctor. But you know,
absolutely. So those indigenous things that we did to stay healthy, because we had no connection to the larger system of medicine. And then once we got into it, we still had no access to the largest system of medicine. I even remember the difference between when I grew up in North Carolina and all my healthcare workers were Black and all my doctors were Black, that there was time mama didn't have a bill and they're like, that's all right. And sometimes my granddaddy paid them in food. That's just how, because my granddaddy was the farmer that was there. So those connections that we talk about. So just kind of connecting when you talked about, you know, the food deserts, the liquor stores, the McDonald's if McDonald's doesn't, not only is McDonald's embedded in Black communities, that becomes the hooray because we have so many Black McDonald owners. So that becomes the heroes. And I'm not saying taking anything away from them, but that becomes the heroes in our neighborhood, McDonald's. But just kind of speaking to that a little bit. Yeah. And bringing up the intergenerational harm.
You know, one of the things that I'm acutely aware of is that in this space, although we know that this space is going to go out into the public space, there is a certain, you know, authenticity, certain honesty. And I want to ask you, Dr. Robinson, you know, why is it that many times when people get in certain spaces, they get certain positions, they become mute in speaking their truth because they feel they will be hurt by, you know, telling people what the real skinny is about what's happening with Black people. They get what we call the delusion of inclusion. Help me out with that concept.
You know, you were talking about, you know, intergenerational trauma, just the whole gamut of academia is traumatic. So, I mean, individuals suppress so much of who they are just to make it through the gamut or the rat race, that you do keep in the back of your mind, I just need to get the credentials so then I can really do the work that my community needs. And then you find yourself at, you know, a community agency or somewhere where you think you can do really good work. And then you find out that that same system that you're a part of is also baked and steeped in racism. And so oftentimes we are bound by certain rules and codes and, you know, any complaints, it's tied to performance review. So that may be some of it, but you know, there is hope because there are a lot of professionals that do take their time to do work outside of whatever that 9 to 5 is, or they do join certain boards within their job to try to push agendas forward. But, you know, sometimes it's, you know, you still have that almost like an ankle monitor that's still on you, no matter where you find yourself going or which institution you end up in.
Yeah. You know, Dr. Barnett, Rosa Parks told me one time, the first step in any liberation process is that the oppressed must first withdraw their participation from their own degradation. Was she wrong?
She was as profound when she said it, and those words still ring true today. It is, as I love what Dr. Bethea said about growing in a community that was self-contained and self-sustained. And it has a way of shedding this sense of accomplishment and achievement that's often imposed on us, right? If you got your shoes from the $5 store versus the $105 store, right? That wasn't a big deal because everybody had $5 shoes, right? So, right. So when you don't participate in that pressure, and you normalize things that are healthy, things that allow you to grow and flourish, it does amazing things for your own well-being. And that is liberation. It is being freed from these external pressures that are placed on you that are not achievable, but it is an illusion that you can get to that carrot. And so what she said was true then, it's true today, and will continue to be true.
Let's go to the word cloud. I want you all to help me. You all are psychologists, and I want you all to kind of help dissect what you see today.
Amazing.
Look at
All right.
what it is. Tell me, Dr. Bethea, what are you looking at? How do you interpret that?
And so what I'm going to do is first, the things that pop out at me first: encouraged, optimism, transformative, collaborating, right? Informed, quiet, listening. And even though there's other words there, we see that there's so much hope. And even when I think about this notion of, I wrote down quiet, that you had lots of time to sit down and think about what's kind of really going on, to dissect it, think about it, be a part of it, be in these little squares. So this notion that people are feeling encouraged doesn't speak to what they're saying about the Black community, because we're mostly Black people on this call, right?
Yeah.
Doesn't tells another narrative, another story than what I see in the media, on social media. I see integrity, I see patience. That's not how they're talking about the Black community. So that notion of telling another story about how Black people handle this pandemic in the midst of the ever-going endemic of racism. So this notion is not gonna go, that's who America is, but we can still write these amazing transformative words about something so insidious as COVID-19 being kind of sprinkled into the whole systemic understanding of what racism is, that it makes me hopeful that I can't wait to get folks' phone number, because we clearly know we got work to do, and we clearly know that we have some of the answers to that work.
Yeah,
absolutely.
That we know what to give to our people, that we are the experts in our own healing.
There we go.
And that we can do that, that
Right.
we are each other's medicine for sure.
Dr. Robinson, what do you see?
I see transformative, determined, I see afraid, and I see blessed. But so as Dr. Bethea was talking, I was having a conversation with myself, and I was saying, if I was someone that came across this show on Facebook Live, would I agree with these words? I think about the patients that I work with every day, and I don't think as many optimistic words would be given. And so I have to be mindful of our education, our standing, our access to medical care, and our privilege does allow for some of these great words to be up here. And I'm also aware that there are a lot of dark, afraid, anxious words that may not be here, but that also still exist.
Wow. Dr. Barnett?
My first reaction, the first thought that popped in my head when I saw this was mixed. How we experience both the blessings and the tragedies at the same time. and learn to live in a space of that duality. That's when I look at the words and the variety and the range of words, that's what jumped out to me, was how we live in that duality and how that has been the story of Black people in America since we got here.
Powerful. Thank you. Take that down and bring us back into the Hollywood squares. I want to bring up Mike Dynamite Brown, and I want to go into the barbershop. I want to go into the barbershop. Take me to
Hello,
the
man, Neil.
Hey, how you doing? So,
Dynamite.
I'm well.
So
I'm well.
what's your thoughts about this conversation? Because we you know we're in the barbershop. So
Absolutely.
what's your thoughts about this?
My takeaway from the conversation, what I heard so far, I had to bring it back home to me and then take it on a broader scale. I think that if we as a people listen to the problems of the people, but put no energy into the problems, because when you put energy into the problems, you're just going back and forth about why you're complaining about your problem. Let's identify the problem as a people and put the energy into the solution. And once you put the energy into the solution, you're not going back and forth. Your point and my point, if you have racism in you or any type of hate for another culture in you, when the other party says what they have to say, then you draw from that and then you put the energy into the solution of the person's problem. And that's how we help each other. And then there's no more racism if we just identify the problem, put no energy into the problem, all of it into the solution. It sounds real easy, but it's a start. And it worked for me in my household.
You know, Omar,
Go
I
ahead.
just want to say, as Mike and the other barbers and Aaron share their experience, we're the psychologists to help us see if they're doing things just naturally that you guys have actually a word for or a theory about. There's things they're doing naturally that we're seeing positive results come from it, but they're not trained psychologists. You understand what I'm saying?
Yeah, well, one is I think it's important to note, and what I gleaned, and it's very profound. What Mike said was this: you need to use your energy towards the things to which you're desirous of, right? You know, I mean, we only have so much energy, right? So what do we want? And then use our energy towards bringing that to fruition. Now, obviously understanding what is going on, so that's part becomes a part of the solution, and also being able to differentiate between symptoms and problems. And I think what we're seeing is a lot of times we deal with symptoms, but we don't deal with problems. Physicians know that, right? And if you don't get to the root cause of it, then you will continue to deal with that over and over again because it will continue to recur. Is that a good thing? Is that okay to say here in this space? All right, so I'm seeing nods. Let me bring up a couple more people. I got people out here. I want to introduce y'all to people. Bring Sharon, Sandra Jenkins up, and Chris Sherlock Holmes up.
And Omar, while that's happening, Dr. Barnett, you mentioned the child support and the burden to a point where someone said, I give up. I think Mike, Fred, the barbers, they see this when people come and sit in that chair. But you're the first time I've heard as a psychologist recognize that weighs on them so much they give up on other parts of their life because they'll never get out of that debt.
Right. Sandra, how you doing? It's always good to see you. You to me, you're a breath of fresh air every time I see you. So keep that spirit. Absolutely.
Thank you.
So what's your perspective on what we've been talking, what you're thinking? Tell them a little bit about yourself. That I think is important to do that, and then we'll go from there.
Yes. My name is Sandra Jenkins, and I'm a proud native of Philadelphia, Pennsylvania. My family are rooted in Philadelphia. However, my father has descendants from Brazil, and my mother is from Virginia. So those two powerful forces together bring this warrior out of me. Yes, indeed. And, you know, I come from a family that's so deep-seated and rooted in the cosmetology industry, in the medical industry. So many family members, you know, either are holistic practitioners, nurses, doctors of that sort. And I must say that all started in a beauty salon. We needed to have a salon in order to make ends meet. So this is a family rooted industry that I so dearly love. So that's really in my blood. But I'm going to say that I was reading that a little the wisdom of our Vice President Kamala Harris, and what I'm taking with me for today, and probably for whenever, you know, for the remaining of my life, is that my daily challenge to myself is to be part of the solution, to be a joyful warrior in the battle to come. And that is exactly where my heart lies. What I'm taking away here is that in the African-American community, racism is so very much like COVID-19. It's a pandemic. It's never ending. It's never ending. And we have, as African-Americans, we have to be mindful of that when we're together in our own little bubble. We have to treat each other with those very inspiring words that we saw in our word cloud. That is truly what we need internally. That's where we need to begin with ourselves. And in order to be, you know, the God-fearing people, we have to really learn how to trust our hearts. And that is just basically the beginning. My son, his name is Alexander Julian Jenkins. I'm so proud of that name because the first day of Morehouse College, he walks in and they asked him his name. And he said, Alexander Julian Jenkins. And they said, boy, oh boy, you sound like a brother. He loved it because my son was rooted and grew up in the suburban sections of Pennsylvania. And the first time he ever was so very proud to hear that his name meant something to him as an African-American male. So I must say, that is just the deep part of what I've experienced in my life. And this industry, I have to say, is so much inspiring, right. So greatly inspiring.
You know, we call the barbershops and the hair salons trusted information centers because in those spaces, right, we can heal, we can share truth, recognizing that we all are possessors of some truth. And as we bring our truths together, then and only then do we get closer to the truth.
You know, Omar, just real quick, and I want our guests to know that Sandra, as a warrior, and the other barbers and stylists have literally transformed their places of business into vaccination clinics, a new home for healthcare. And it's a space where we can bring the emotional health services. And that's what I want you to think about. We now have a network to embed resources that our community needs. And we're not twisting arms anymore. Now the phones are ringing off the hook. When's the next vaccine clinic? When can I get a test? Hey, you doing flu shots? That's happening right now. We got to keep this thing going.
Yeah. Chris?
And Dr. T, if I can share.
Go ahead.
So about 2 years ago, just about 24 months ago, Milwaukee County, Madison, Dane County declared racism a public health crisis.
Okay.
About 4 months ago, I decided to take on vetting and saying, okay, you declared this. What are the meetings stating? I could not find a single meeting that's been held. And so I raised that as a concern with my voice, but I realized early on that my voice was not powerful enough, just me. So I went to the barbershops and I basically said, okay, this barbershop has 3,000 men coming there as clientele every month. This one has 15. This one has 7. And then I went to my Mason brothers, 18,000 strong. And so I now presented that to the city and said, we would like to see some results of you declaring racism a public health crisis. You just can't declare that and there's no follow-up. It sounds good on paper, it looks good on paper, but now we're saying we are going to give you a grade, a report card.
Good.
And I'll keep you guys, updated on that. But again, bringing the barbershops together, that's 9,000 brothers that we see every single month. And my Mason brothers, we said, no longer you're gonna, throw a dog a bone. It sounds
Right.
good.
Right.
But if there's no follow-up, we're not going to be bamboozled anymore.
Well, Aaron, what you are is basically a fruit inspector. A tree is known by the fruit it bears, right? Right. Dr. Bethea, what were you saying? And then I'm
I
going to
just
come
wanted
to
to
you,
give
Chris.
a proper plug for ABSI. So as you talk about the salons, so one of the things that we're working on is busting up the monopoly of APA. And we
Say
have,
what that is for the larger audience.
so,
APA, what's APA?
oh, the American Psychological Association. Do I have to say it? It makes my throat hurt. No, the American Psychological Association, and take their and busting up this monopoly that they have dictated, mandated, politicized, legalized, that APA is the way to whatever wellness is. So ABSI, and that's another whole show, they wrote the most bogus apology ever, but they indicted their stuff about all they did to people of color and Black people in their whole inception. The American Psychiatric did the same thing with an apology, because that whole thing, like, it's okay to do this. They also indicted themselves and laid out all the crimes committed. And we talk about the NCOBRA report, if you haven't read that, of all the harm done to Black people. There's just reports out there going to Congress now, and all these agencies, in their attempt to apologize, they're actually indicting themselves. So ABSI went against that. We're like, bogus, we're not doing that. Took our own authority as Black people. We're gonna license ourselves. So now we have in place a licensing project, a licensing, not only a licensing process, we want to include barbershops. We want to include in licensing. We want to include salons, community healthcare workers, because when it comes to Black people healing themselves, we do it everywhere. Grandmama's business. It's like, so we have like an outline, if you fit, and we have we call them portals and pathways. And there's a portal pathway to licensing for barbershops, for salons, for community health service, so people doing the work on the ground. And we want to use this and continue this to bust up the monopoly of APA, who has hurt our people for over 100 years. By saying, be certified with us, learn in a way that's respectful to our community, that's led by our community in our traditional community ways, from Africa through North Carolina, Mississippi, Alabama, because we've been doing it. And that whole notion of the joy. Yes, there's a lot of people hurting. We don't hear enough about the joy and how we connect and how we can be together and how we can do this ourselves. We can take our own authority and be. We don't have to listen to that anymore. So hopefully now I'm saying it here, folks can join us.
Absolutely.
ABSI for eternity. We don't have to be.
I love it. Love it.
Absolutely. Good. Thanks, Dr. Bethea. Chris, Sherlock Holmes.
How's everyone doing? All right. Nice to see everyone. Thank you for the opportunity. Just really quickly.
Tell them who you are, Chris. Tell them who you are.
Chris Sherlock. So I'm had the pleasure of working underneath Dr. Thomas here in Maryland, in charge of going out and recruiting barbershops and networks in Prince George's County, Montgomery County, and Baltimore City, in priority zip codes. So we have had the privilege of going out and really pounding the ground and building a network in an attempt to save lives. But more importantly to me, this particular seminar has really resonated with me, because from hello to our new extensions, it was instinctively different. And when I say instinctively different, something just stood out to me as to, I didn't know who the names were, but I knew they were of some significance. And immediately I thought of Back to the Future, the movie of Back to the Future. And Back to the Future, meaning you have to go back to the foundations in order to further yourself in the future, because without that, you'll be lost, correct? And Dr. Bethea mentioned the word foundation. Our problem, we can start building things and building great plans. It's no foundation. So it's not sturdy, it's not stable. So it will crumble. So then you bring yourself to the question of how do you break those cycles of violence, the cycle of poverty, the cycle of racism, single family. How do you break those? The one thing that resonated with me is that we as humans get caught up in the details and we symptom chase, but that will not save the problem. It will not solve the problem. So I thank you all for presenting. I thank you all for tackling a very overlooked and very important foundational subject. And it has so many arms that you can try to attack one and another one's going to pop up and another one's going to pop up. So in short, the word cloud, we take really great pride in that because the word started off dark and daunting. And anyone can get on anyone. If the visitors look and say, how could these people, how much money are they getting paid to put these words in? What'd you say you're going to put these words in? Look, being on the cutting edge is just that. It may have started off dull and daunting, but all of these arms connected together have sharpened our blades. And we have a new look of optimism because we're seeing the true story. We're out here on the ground seeing the needles go in the arm of otherwise individuals who would not get them because of transportation issues or because of they're homeless. We reach the people who think that we forgot about them. We exist. It may be a small arm, but we exist. And I take very much pride of being a part of this network. And I thank you all for extending your expertise. And I'm truly motivated about taking this on. And I thank you.
Thank
Give
you
his
so
brother
much.
some snaps. Give his young brother some snaps. We need that generation. Yes,
absolutely.
Right.
That's young blood there. Dr. Francesca Weeks. Let's bring her up. We got this. I'm telling you, you all need to know what we do here. This is what we do every week. Now, this is not anything. Hey, Dr. Weeks, how you doing?
Good evening, everyone. I'm doing well. How are you?
Good. Tell everybody about you and the work you're doing.
All right. Well, I am Dr. Francesca Weeks. I am the owner of the Genevieve Strategy Group, which is a racial health equity firm. I work in several different programs and policies. One of the projects I work on now, I'm an African-American consultant for COVID for the Baltimore City Health Department. And so that's where I work with Dr. Thomas and Chris as we're working with the barbershops here and the different networks of barbershops and beauty salons here to make sure they're getting the resources they need out to the community, as well as they have everything they need going outside of COVID to do education in our community. And the other piece that I do is I work nationally on preemption policy and policy work. And I will say this conversation, I needed this therapy session today. Across the country, it has been a rough week for legislative sessions. The attacks we've seen on communities in Texas right now, they are trying to, in the communities of color, they are restricting in the libraries, taking out any books that teach about Black history. So they're currently pushing these different policies through. And right now, our communities, which they pay tax dollars for to have these books in the library, are being attacked across the country. So that's just a little bit about what I do. And like I said, like everybody else, I love the work that I do. But this therapy session with being among you all tonight is something that I needed.
Well, we need you too, so we need each other. Let me do this. Bring Aaron. Bring Andre on. I have not seen Andre Russell. I'm going to bring Andre on. My tech team will just jump on me if I don't bring him on anyway. Hey, they love you. Hey, Andre.
Hello, how are you doing? Wait, do I only have 3 seconds this time?
No, I'm giving you 4 seconds.
And you got Dr. Tuesday here, Andre.
Yeah.
Yeah, go ahead. Go ahead, Andre.
Andre Russell. I'm a small businessman in Atlanta, Georgia. I've got a couple of barbershops, but I was kind of surprised when a couple of people said some negative things about fast food because I grew up in the fast food industry, and I've had a couple of McDonald's. And but all that money was eaten up when I opened up the barbershop at the airport. But Dr. Cook said a couple of things. She's very enthusiastic about what she does. And I happen to be one of those Black men that have a obesity problem. So I intend to get in contact with you because I definitely need some diets and some therapy.
I'm happy to help any one of my people.
Andre, you made a salient point. We need to figure out how can we take care of ourselves,
Right.
and
Well,
eating is very important to that. So and that's got to be some psychological thing too. Y'all need to help me about feeling the need to be mindful of what you put in your body, right? There's a certain appreciation because people are more concerned about the octane that they use in their cars and the oil that they use in their cars than what they put in their bodies.
Mm-hmm. Well, my thing was I've been busy being busy for quite a few years actually. 4 sons all through college, which helped suck up some of the
give it up for that, Dad.
Right.
And so this was a therapeutic session for me because I appreciate each and every one of you guys had something positive to say and went straight to the direction where I am. And I've been mentoring for years through some through the 100 Black Men here in Atlanta, some through other things that I've been doing through the churches and whatnot. But like I said, I've been busy being busy, and I eat as I go. And I also have a problem with my wife with my dietary thing. She just came and asked me for my credit card. I don't know if you guys noticed that. So, I'm not sure what that was.
Well, you know what? But one of the things we have to do, one thing we got to do is we got to talk about it. This is therapeutic. If you notice, people were saying that we needed this. We need each other. A couple of things we need to do. I'm looking at. I got 3 minutes, and I got to go to rejuvenate and it's Katrina. Katrina, are you camera ready? Or can you speak? Can you say something to me? Katrina Randolph, are you there?
Well, I'll just say goodbye while we're trying to get
But while we're setting that up, Andre.
And this, all you guys, I appreciate being with us. And by the way, I need one more thing to say. When I started off with the shots at the shop, I talked to Dr. Spivey, and what she has done, she's the health director for DeKalb County here in Atlanta or in Georgia. And what she's done is she's taken it over. And from when I just did a couple of hundred, she has now done several thousand shots and tests at my location at the mall. So I can't take responsibility for that, but at least I got them started. So
well, you're part of it, man. We all are part of this thing, man. Thank you so much. We appreciate you.
Omar, just real quick. The fact that Andre, and he's not going to talk again, said he made a connection to Dr. Tuesday Cook. You don't think anybody's ever told him about weight loss? In this space, relationships are being formed, trusted relationships. And for the psychologists here, to the extent that that's therapeutic, this is something we can continue. Go ahead, Omar.
Yeah, Miss Rejuvenate. Why don't you tell people who you are and you got just a few seconds. I'm gonna do you like I did Andre last time. Okay.
Well, I'm Stacy, owner of Rejuvenate Salon Spa and Fitness, and to speaking on eating right, I'm on day 2 of being a vegan, becoming a vegan. So I'm on day 2. So I'm going to leave you guys real short. You may shoot me with your words. You may cut me with your eyes. You may kill me with your hatefulness, but still, like air, I rise. So it was a great conversation today, but Maya Angelou said it all. And I appreciate all you guys. And I'm gonna keep rising on day 2 of vegan. I'm doing better. All right.
Good.
I'm a snap for myself.
Absolutely. Absolutely. Snap.
That's right.
Yeah. Well, hey, I don't know if you all know this, but I'm looking at the clock. We got 1 minute left.
Unbelievable.
Right. I often say I only have a minute. 60 seconds in it. It was forced upon me. I couldn't refuse it. I didn't seek it. I didn't choose it. But it's up to me to use it. Suffer if I abuse it. Give account if I lose it. Just a 60-second minute. But an eternity is wrapped up in it. And so I thank you all. I thank each of you for your sharing. I thank you for sharing your truth, because it's your truth that is healing for us all. Thank you for taking care of yourself, because you owe it to yourself. You owe it to us. You owe it to your family. You owe it to the ancestors. And so for all you do, both seen and unseen, I merely say thank you. To Dr. T, man, love you so much for convening us. And to AB Psi, you all have a place here. Yes. I want you all to know that you are part of the family.
Absolutely.
Right? Dr. Barnett, Dr. Robinson, Dr. Bethea, you all are part of the family. We love you with a perfect love. And to all of you out there, we were going to do, Meg does the
Public Health Minute.
Public Health Minute. I didn't even do it this time because I didn't want to break this flow. And so we'll do that next week and give you the numbers. But I wanted the flow to be, what can we do to heal ourselves and each other? That's what I want it to be today. And we know that there are a lot of people dead and are suffering and hospitalized. But we'll get to that next week. But I want to tell you this: take care of yourselves, because you owe it to yourselves. And as always, I'd like to leave you with these two words. Remember that I love you with a perfect love. But more importantly, remember this: you got the power. Until next week. Bye-bye.
You got the power. See you next time. Spread the word.
Love you all.